Anyway, it is 4:02, and we can start this meeting. So the agenda for today. We want to start by approving the minutes from the last meeting.
The last two meetings. I think I sent you, what, the 18th and the 25th, so I need a motion.
Yep, I make a motion to have Jerry sign the meetings and approval for the meetings, the last two meetings.
I'll second that motion.
Actually, I'm going to need you to sign another document too for Sharon, so I can have you both sign the minutes at the same time.
Okay,
Okay?
I can stop by tomorrow and do that.
All righty.
Can you close the fridge?
I did.
Thank you.
All right, so Kate seconded. All right. And I'll approve. All right.
That's like when I try to do meetings at home. My son is usually right on top of my lap. Very interested in everything I'm doing.
Okay, so
Ryan broke her ankle, or she fractured it, and it's a massive sprain on one side and a fracture on the other. So I guess when you do it right, you know? She's having some issues today.
poor kid.
Yeah, she'll be all right.
Oh.
So, sorry.
There's no little problems with you, Becky.
I know. You kind of just roll with it, you know?
Roll with it like your ankle, but
Well, in her case, yes. Next on the agenda is the approval for the annual town report.
Yep. You need a motion?
Make a motion to approve the agenda, to approve the annual town report.
second that motion.
Okay, all in favor?
Aye.
Brooks, aye.
Okay. Next.
Next, on the agenda is to amend the date for Sharon Hart and the contract tracing. So, what do we have on the date for her? Is it June?
It's June 30 of this year, but if we go into December, the CARES Act goes through December 31st. Our funding goes through the 31st of December.
Right.
So that covers us either through the December 31st, or if the governor releases us from the emergency order.
Yeah. So I'd like to make a motion to extend Sharon Hart's contract to the end of December through the fiscal year.
I'll second that. I'll second that motion.
All right, it would be through December.
Through December 31st.
Yeah.
I don't know why I said that.
Because it's Monday.
Because it's that kind of Monday.
That's right.
Could I just ask a question?
Sure.
Well, what did you mean unless the governor releases us from the emergency order? Does that have implications for the contract?
It does. At that point, if he releases us and ends the emergency orders, it would mean that we don't have, an abundance of cases. I mean, we could always, revisit it, but this just takes us through the 31st of December in case. I mean, he might decide that by October we're good and he's going to, end the emergency order.
Okay, and in that instance, we wouldn't necessarily, assuming he wouldn't do that unless everything was good, and then in that instance, we might not need contact tracing. Is that right?
That's correct.
Okay.
But the board always has the authority to take a look and review it.
Right, so we could revisit it. If
You can revisit it.
Right. I feel comfortable having something in place though until the end of December. I don't
Right.
see it going away, but
I think we should keep at least through this end of December, and then we have to reevaluate and look at what's happening in the current month.
Absolutely.
Or look at it maybe again in September, October.
Especially this year, learning everything's month to month, week to week. There's no, there's no guessing what's happening next month.
Okay.
You'll need to do a written amendment to extend the date also.
Okay.
I have that ready for Kate to sign, and then you can sign that tomorrow, Becky.
Sure.
Great.
And then, so my question to that is there's line item for personnel and clinical through the CARES Act, and it says that we incurred $4,500 of expenses in the first round, but there was still remaining balance in personnel. And then there was also PVPC money that if there wasn't sufficient funds in the CARES Act, that the money through the PVPC could be utilized to cover the cost of the contact tracing.
We have held that in case, just in case. You're correct.
So we have two options there, and it'd be good to have a more detailed account of what has been spent so that we can really have a clear idea of how to move forward and which money will be utilized to cover the cost of the contact tracing as well as other labor expenses. Okay.
I agree.
Okay, now you need to nominate, if you're going to, Nicole as the animal inspector for the next year. You make the nomination and the Department of Agriculture goes ahead and appoints Nicole. So she's gladly said she'll do it.
I'll hide hope so. She's very good at this. I'd like to nominate Nicole Fletcher to be the animal inspector of Southampton.
I'll second that motion.
Okay. And in terms of our updates, I noticed today on the state's website that there is not sufficient vaccine. We're still having problems getting vaccine out here, and especially to the Northampton regional site. So I've encouraged people just to keep trying and,
Jerry, do you have a list of people that are struggling to get vaccines at this point?
Not right now. Actually, I was working with Joan last week, and I think we got about 9 people. Kate got some people too. We've gotten people in, and I do have one gentleman. Hopefully, I'll be able to get him in maybe on Thursday.
Anybody that's expressed that they're having trouble getting an appointment, I've been more than happy to seek out appointments for them online. And we've actually had really good luck getting people into various clinics. The one thing is that I received notice that the Northampton Vaccine Clinic has declined some teacher appointments for as recent as their most recent clinic, saying that they could only go on designated days. So there might be some teachers in town that need to be rescheduled. But otherwise, people are really, I think we got everybody that's been eligible in for appointments up to date that I'm aware of.
I'd like to say honorable mention, Kate, you've done a phenomenal job in town. I know that you went out live on Facebook World, and the amount of people that you helped and get vaccines, like tremendous effort on your part. Tremendous. Francine, go ahead.
Yeah, and I'll just second that. Just from all the people that I know she's helped. I mean, people to roll out a computer thing, scheduling for people who are older and who may or may not have computers or internet access was really a challenge, and you were tremendous help. Thank you.
Not only that, but I swear she doesn't sleep. I don't think it's part of like.
No, I sent her an email.
No.
When do you
I
sleep?
know. She's up at 4 and 12. She's like, hey, did anybody check the CVS site at 2 a.m.? I was like, no, I haven't. Did you?
Well, that's the only time you can get people appointments.
I know, but incredible dedication and thank you. And I feel comfortable speaking on the behalf of a majority of town residents. I know they help. So
Well, hopefully we'll
very
be
much.
able to get more vaccine too.
I know.
I think, by April 19th, everybody is supposed to be eligible to get
Yeah.
vaccine, anyone over 16. So that's going to open things right up.
Mhm.
The demand is very high. Even just today, there's a lot of demand for appointments, and it's hopeful that it'll get a little bit easier coming up for people to be able to get access to appointments.
I think it will be. I think
it will too.
hopefully they'll streamline something through.
Now that the weather's getting warm too, people are beginning to wonder when, they can really open things up. Barbara at the library was here just before the meeting started, and her trustees want to know when they can sort of, begin opening up. I don't know what's going on with the town meeting yet, though.
I do.
Or Francine.
I have a question. This is just, you were saying about opening up with the public. There isn't anything right now as far as sports, because I know soccer is going to start looking to go outside, softball, baseball. So what's the idea about outside sports at this time?
The governor said that, he's actually laxing outdoors, it's totally different, right?
Right.
As long as you can appropriately socially distance. So is it contact sports that are limited?
Yes, they still, the indoor sports too, it's a little difficult and it changes. And I haven't looked at it today. Did you go on the, no?
I haven't done anything.
I can send it to you. I'll check it and send it to you and see where they are. I know my granddaughter plays softball, but I'm not positive.
But masks are still a must, correct?
Yes.
Masks at this point are all still a must outside, as long as they can stay distance outside. I just want to kind of make that clear for some of the activities going forward,
Yes, and I think that there was additional changes coming up. Maybe it was April 1st. I'd have to look at what he was saying, but I think that there's plans for it to change again very soon.
Right.
So I'm sure there'll be additional
And
guidance.
I think they're going to change almost from, Tuesday from our conference calls, tomorrow afternoon to Friday, and it keeps changing. So you have to stay on top of it. But I can email that to you, Becky, and I'm sure that some of the coaches they must stay on top of that.
Yeah.
And in-person, 5-day in-person learning is happening very soon too, right?
April,
Yep.
I think.
April 5th.
So that's exciting.
That is exciting. I think everybody, the kids and the teachers, are anxious for this.
I think the kids, yeah.
Yeah. I think it's going to be good for everybody. I feel confident. I really hope, I know, Caitlin, you've been in touch with the school, that I would hope that all the teachers that wanted the vaccine have gotten it at this point.
They were scheduled, and some of them went to Northampton, and that they said that they couldn't get the vaccine unless it was specifically scheduled days. So I'll follow up and see if some of those appointments need to be rescheduled.
Right.
But I did check in with Norris, and I spoke to people at Hampshire Regional High School, and they did say that everybody was able to get an appointment scheduled.
That's fantastic. That was
And they actually made a mention of that on the last school committee meeting, that everybody had an appointment that wanted one. So
awesome.
that's great.
And I don't know what the guidance will be for proms and for graduation yet.
Yeah.
So that's coming.
Well, I hope something for them. Next on the agenda, it was updates. I think there was animal inspector updates, but Nicole could not make it today. Health inspector updates.
she's still booking, it's the real estate season now is opening up, even though the interest rates have gone up a tiny bit.
Yeah.
There's still a fair amount of real estate that moves, or we're doing perk tests and Title V inspections for sales. It's busy. I mean, the realtors and the contractors are calling here constantly for information on septic systems.
Yeah, there's a lot of building in town.
So,
Well, that's a good thing, right? It's exciting.
Going into, I know that we had, there's been some discussion going back and forth about our budget, and I think that we concluded today, just to make record of it, that we're not currently in deficit. On paper, I think it looks that we're minus $14. However, the paper isn't accurate. Is that correct, Jerry? And we actually have a plus of $15.
That's correct. We're about $17.30 or something to the good, because revenue is booked, and there was a credit that we got from WB Mason. So we are not in the deficit. We're still in the black.
Awesome.
Not by a lot, I might add.
Okay.
But we have not overspent our budget.
Okay.
And one other thing about that is I noticed that we have there hasn't been a ton of sharps returned because, for whatever reason. So if we did need to transfer money, we do have an adequate amount of money in the sharps program that we could utilize to cover any additional expenses through the end of June.
I'm a little nervous about that, I got to be honest, because I don't know when the police station is going to open back up their drug take-back program. They've been down.
I saw something about that very recently online. Mm-hmm.
Yeah, I made a mental note to ask about that the next time that I'm around that way. So they haven't had a drug take-back program for quite some time. I think since COVID happened last April. And that's a lot of medication that kind of store up when you kind of used to putting things away. And I really think that that's what took a hit on the sharps disposal is people. And I personally get a lot of questions about where to dispose of them. And I tell them how and where to go to dispose of them. But I fear that they're going in the trash at this point just because of what's happening right now.
Actually, Becky, some people took 2 and 3 containers, so they didn't have to keep coming back.
That's a great idea.
So now I'm beginning to get them back.
Okay.
I think everybody was sort of closed in for the winter.
Yeah, probably.
Sorry, go ahead.
Go ahead.
I was going to say the drug take back day, the National Prescription Drug Take Back Day is April 24th. So you're right. That is coming right up.
Yeah. So maybe
I'd seen it somewhere.
Something about that on the Facebook page for Southampton.
Yep, April 24th. And the other thing is, it'd be really great I have the draft for the CARES Act expenses, and I think it would be, I know it's a draft, and maybe Ed, you can shed a little bit of light on deciphering what the actual expenses are, because it seems like we do have some outstanding funds for PPE, personnel, a little bit of money left for wages, but it's really hard to tell with this spreadsheet. So, maybe in the near future, we could figure out what remains.
Look, let me explain this to you, Kate.
You can't.
The health department's expenses aren't recorded on their own. Everyone's expenses for the COVID Act is in that one account. So it's not just as easy as going in and checking on an account number to see what health department has spent to date.
I understand. So then maybe we can figure out internally what has been spent, because I'd like to, if we have money funding remaining for PPE, maybe there's somebody in town that would benefit from that.
Part of the problem is the town gets one bucket of money.
Right.
And then the departments would say what they needed. And some of that on those sheets, it was very preliminary.
Right.
So it's difficult. We just need some hard data.
Yeah, I told Jerry I'd work on that with her.
Yeah.
Because as I do the reports, I've been pulling out the health department ones separately just so we can account for that.
We have some time. I mean, it's approved through December 31st, so there's no urgency. You know, there's going to be needs that are going to pop up through the end of the year. And so I don't think it's a bad thing for us to have some funds set aside if the need arises.
Right, because you never know what'll change or, something we haven't planned for.
Correct.
Well, I think at this point, most of the departments are okay with the PPE. I mean, we just got another delivery from MEMA just a week ago. So, I mean, we'll take a look at this and see what we can put together. And, it's just been hard. It's just crazy busy here.
Yeah.
But
It's definitely a busy time.
right. No, but it would be nice to know exactly, what did get spent, what did you buy? And I think that's important.
We'll get there. I know that it's, with the new accountant, I'm sure she has a lot to figure out also.
We'll get it there.
I'm sure you will.
Thank you, Ed.
Oh, you're welcome.
Anything else?
So I did just want to make mention of the Public Health Excellence Grant, and Jerry also, I know, has had a couple conversations about it. So there was an informational session on March 18th, and I attended it just to kind of hear what they were thinking about and what it would take, or, if we would be eligible to apply for a grant like this. They did say that some of the funding was not exclusively for regionalization because the timeline on this is incredibly short, right? You have to have an application ready by April 1st, and this presentation was March 18th. And I've learned a little bit about grant writing through being on the grant committee, and I know that it's a very collaborative process that involves a lot of time and research and documentation and buy-in. And so I was kind of surprised that they had such a stringent timeline, but it seems like this is a recurring grant opportunity. It's not just this year. It's funded for the next 3 years. And Jerry said that you have to have 3 communities in order to qualify as a public health district. But the goal of this grant would be to improve access for the public to improve public health, which could be through staffing, which could be a clerk, a health agent, a public health nurse. It could be through regional services, so shared resources amongst multiple towns. So it did seem like it would be something pursuing, even if it's not this year, but in the future. And Jerry, you said you were going to talk to a couple people about.
I've been talking to Bree in Easthampton, the health director in Easthampton, and we're hoping actually that we can get an extension on this. We're going to make some calls tomorrow. Because they recognize that everybody is really busy right now and trying to get an application in and, deal with 2 other communities. And you have to have one community agree to be, the sponsoring community. It's not easy. And I think DPH was really sort of pushing it a little bit right now.
Right.
This is coming out of the special commission's final report and trying to fund public health. There are a number of areas that the state really is going to have to look at. And one of the areas is going to be adequate wages for the future, because there's going to be a whole group of people that will be retiring. And if you have younger people coming into work, these are the folks that now have graduated from school. They've got school loans, they've got rent or mortgage, car loans. They're going to have an adequate salary in order to, even entice them.
That is a concern for the future. That is
It is, and it's about resilience too, right? So this grant program lasts for 3 years, and it says that I was looking for this particular slide. It says it is anticipated that a significant portion of the funds will be used to support staffing, including contractors and consultants, which could include health director, agent, deputy assistant director, inspectors, public health nurses, which I think that our specific community would benefit from having more access to a public health nurse, epidemiologist, and shared service coordinator and or clerk. So it sounds like, something that would be really interesting in pursuing. It just seems like trying to pull multiple districts together. And they acknowledged this during the presentation, like thinking about anything else besides COVID-19 right now seems really hard for public health departments. But I did ask the question and I didn't feel like I got a clear answer. I said, could this money be used for planning, like a grant towards doing a feasibility study or some sort of analysis of our department or our region to see what would work best, because I personally don't feel like I know all the answers, and I'm not, to be able to look at it from a more global perspective. And I still really want to try to get the answer to that question. I put there was a moderator, I believe her name was Amanda, or was it Phoebe? Phoebe, okay. So I did send an email saying, could this be used for analysis or for like a feasibility study or something, because it's not just as simple as snapping your fingers and saying we're going to collaborate with these communities in order to restructure multiple towns' health departments, right? It seems like a big undertaking, and you definitely don't want to cause instability, right? So you want to look at it from a global perspective, right? And I don't feel like I am equipped to be able to do that or qualified to be able to do that, right? So I'd love to hear more about that.
Could I just ask, you said this is a 3-year grant. Does that mean that they're not going to be calling for applications again till the end of this 3-year cycle?
No, I think it seemed like it's so hard to say. Like, again, I have the slides in front of me.
That was not clear.
They did not say in the presentation that they're not going to be calling for applications. It seems like what they're really trying to do is actually get state money and funnel it towards these initiatives every year. Like, it's not just one and done. It seems like they recognize that this needs to be an ongoing initiative that so far is lasting 3 years. And so many people ask the question on this meeting saying, okay, so what happens after 3 years? Right? Because that's everybody's worry. So say you restructure, what's going to happen after these 3 years of funding? You can't restructure, get your salaries paid for 3 years and then fall off a cliff, right? Like, these people are going to need ongoing funding. And so they said that that's all in progress. But I think it would be great to, if some of those funds could be used for salary and wages, right? And I've heard from many people in the town that they think we would benefit from having a clerk in town, or that we would benefit from shared health services. So I just would love to know what that would look like.
But I think that if we can get an extension, or if Phoebe, can kind of push DPH, this is just too fast and too meaty. And in order to do an appropriate job, we'll find out. I'll calls tomorrow about doing a feasibility study and see who's even interested.
That's the tricky part. Everybody else has to say okay too, right?
Right.
We can say, yeah, this is great. And then
but we are confined to 3 communities. So
yeah. And it's because a lot of the larger small towns, right, they have a totally different population, right? So you look at our surrounding communities like Easthampton, that's totally different than, say, Westhampton, or in the Foothills district, they said it was like Goshen, Westhampton, and somewhere else that's its own district.
Well,
right?
Westhampton's not actually in the foothills. They sort of use the foothills, I guess, for some of their needs. Montgomery is another small town. I know Northampton is not interested in, they're a big city, so.
Yeah,
that's
they got their own means right now.
Right, that's different.
I thought the other interesting thing to think about is there's two ways to look at it. There's ways to maintain independent governance. So say like Easthampton remains separate from Southampton, like each maintains their own board, or there's certain people who have a collaborative board where it's shared governance, which is totally different, right? Like that's just that's an extreme difference.
That might be in the eastern part of the state with the Blackstone district, or I think they had a list of, there are different formats for doing this. And for instance, I kept the government. And the county government supplements each of the towns. Each of the towns keeps their board of health, but if somebody's on vacation, somebody's out sick, then they send somebody in that's qualified to fill that seat.
Mm-hmm.
We don't have county government anymore.
The other thing I thought was really interesting was about how the goal of this is to ensure compliance with regulations and to provide training opportunities too. So I wonder if, even if it's not this year, are there opportunities for us to improve credentialing for, say, Nicole as the animal inspector, or training that might allow for more people to become food safe certified, or, just as throwing two ideas out, but if there are resources that could supplement our training for
actually the credentialing is something that special commission is doing, so that, and they're doing it in steps.
Mm-hmm.
So hopefully that will come down. I think that should have been the first step before they jumped into this, but
it seemed very it seemed like very big to happen in such a short period of time. So I'd love to hear, Jerry, what your conversations are with the, about an extension, or about what our, other communities are thinking about it. And even if it doesn't happen this year, is it possible to, kind of think about this with more detail in preparation for next year, when hopefully we won't be in such a vulnerable spot.
Even the fall. I mean, a lot of times, I think that we'll be in a pretty good place in the fall. And if they have a second round, we can apply then.
Right. If they allow us, that's the thing,
Well, we'll work on them.
Yeah, right. So I think that'll be good. I thought it was a really great presentation, and I thought it would be something worth looking into, at least. I know, Becky, you're on a short timeline today, so I just wanted to bring up that presentation.
No, I'm glad you did. It was interesting. I'm glad you did. I hope something works out with it,
Yeah, me too.
Is there anything else anybody'd like to talk about?
I'm good so far.
I think we're good too.
I think we're all good.
Anything to add, Francine? Anything?
Nope, I'm good. Thank you. I'm just listening.
All right. I'd like to adjourn the meeting then at 4:35 p.m. And Jerry, about 11 o'clock, okay, tomorrow or something like that? I can text you before I come down and I'll sign off on all those papers.
I think I have a conference call. Are we having a conference call tomorrow, Ed?
Yes.
11 o'clock, right?
I'll come after that then. Text me when you're done, and then I'll make sure to be home, and then I'll run down there.
Or do you want to do 10:30? Is that good for you?
I got someplace to go in the morning with her. So
okay.
It's in the afternoon, as long as you're there.
Yeah, I'll be here. I'll send you a text as soon as I'm done with the call.
All right. Sounds good.
Thank
you, everybody, for attending.
I'll second your motion to adjourn.
Yes, thank you, Kate.
Thank you, everybody.
Have a good evening. Go out in the sunshine.
I will. Thank you.
Bye, guys.
Yeah.
Bye-bye.
Bye-bye.